Welcome to Pediatric Gastroenterology.
I'm from Hong Kong.
I'm from India.
I'm from Madrid, Spain. I'm from the United States.
My family's originally from Pakistan.
I'm from India.
I'm from Nigeria.
I'm from Colombia and Panama.
Soy de Puerto Rico.
I'm from India.
I'm from Vietnam.
I am from Mexico.
I'm from Texas.
We take pride that our program has people from all over the world. This has helped us achieve two important outcomes: enriching the diversity of our training program and caring for an underserved patient population. Wellness and work-life balance are extremely important. Our program offers an annual wellness retreat, a faculty fellow mentoring program, healthy drinks and snacks in the fellows office, as well as social gatherings and events where fellows and attendees can interact in a fun and different way and enjoy the city of Dallas. COVID-19 pandemic has been a challenge for everybody. But even during this difficult time, there is always a smile behind our mask. The question is, where do you find one of the country's best and more diverse pediatric GI teams? UT Southwestern, that's where.
Pediatric GI is one of the busiest pediatric specialties. We have an amazing team that offers support to kids with a number of different problems. A lot of times they come in with the onset of a chronic disease, or they've been sick for a while and people haven't been able to diagnose them yet.
I don't think we realize how debilitating even abdominal pain can be on a daily basis to a child who can't go to school, who can't participate in sports. And these kids really just struggle to keep food inside. It's something we take for granted.
Oftentimes, this is not a life-threatening issue, but it is a life-changing issue. And we're there to support them.
We have psychologists, we have nurse practitioners, we have child life specialists, we have dietitians. When we see a patient, we offer a complete evaluation.
It's not just looking at the gut and treating the gut. It's everything in the whole body.
I take my time to listen to a parent. If a parent wants to talk to me and they have a part of the story that they're telling me, I want to hear it. You have to let them express their worry. And I think understanding what they're worried about is a key to understanding how I can help that child.
I ask questions to the parents, and sometimes I ask the same question to the kid to see their perspective. And it's interesting, sometimes there may be two different points of view, and in a way that's something that is useful for me when I have to make the plan.
Carson was 18 months old when we started coming to Children's. At first I thought it was, maybe he's just being picky, he has food allergies, he's getting tired of the same food, but when your kid can go 5 days without eating, that's more than just being picky.
Our goal is the child and make that child better. So there's no egos, everybody has a role here, and no role is more important than another. We're all complementaries.
I love it when children who have been fed by tubes in their intestine come back and say, Dr. Sangvi, today I'm going to get my tube out and I don't need it anymore.
If a parent feels like their child needs more help than they're getting, then all they have to do is call.
From now on, he's a normal 10-year-old, doing normal 10-year-old things.
Our team has grown to such dynamic people, so not only do they specialize in their areas, but they excel in their areas. You go to any national meeting, and the team from Dallas is always going to be presenting a talk on that specific topic. They are national experts at whatever they do, and they're just such a fun group of people. Part of what makes me happy about coming to work is this group of people. This is, in my opinion, the best place for GI care, and it's a biased opinion, but I think it's true.
In North Texas, we have one of the most diverse, both ethnically and socioeconomically, patient populations in existence.
Over 7 million population, over 1 million children. There are no other academic pediatric hospital in DFW area other than Children's Health.
Things that I read about in textbooks, I actually see them come to life in our emergency department. So the breadth of pathology is amazing here.
The reason that we want to work in a place like this is that there's a certain satisfaction and pride in being able to say yes to people and say we can fix that, we can make it better.
Our academic affiliation at Children's Health has always been with UT Southwestern, and that's been a fantastic partnership. It gives children access to some of the best minds in the world.
It was a commitment to invest not only in things to treat the common conditions that are run-of-the-mill and are high volume, but also to go beyond that and be a center of excellence for diseases that are rare.
We are constantly innovating, and we don't really have a lot of hesitation from bringing things from bench to bedside.
But that means recruiting people that are even more sort of a different skill set, different focus, so that we can all kind of complement each other. And having programs that are unique and innovative that no one else can actually do.
We have experts in every type of diagnoses. So we have experts in bone marrow failures, which is a blood disorder. We have experts in blood clots, which is a different type of blood disorder. We have experts in leukemia. We have experts in solid tumors. Having such a big facility here and so many patients, we're able to specialize.
I can get a 3D image of the blood vessels in a baby's brain in 20 minutes.
The CAR T-cell program that we've developed here, that has saved a lot of patients' lives.
The people, the resources, the infrastructure, and then when you add to that the opportunity to really push boundaries of care, that's why I came here.
We really think about new ways to offer new surgical options, new imaging options.
We want to be a one-stop shop for everything. And it doesn't just stop there. Not only do we want to be able to do it, we want to be able to do it well. I would put our program up against anybody's.
I do have close relationships with people at other centers who do my job, and they know who we are. They know the work that we're doing. They know our name, and they know that we are pushing the boundary and really trying to fight to make advancements for kids.
If you're passionate about children and you're passionate about improving their outcomes, I think this is the place to be.
There's nothing really more satisfying than making a difference in the life of a child, and you're not only helping the children, but you're helping the families as well.
We're making a difference. I love that fact about my job.
People who work in this department really enjoy what they do and are the tops in their field.
We all kind of bring different things to the table and challenge each other and help each other, and it's just a lovely environment that I wouldn't change for anything in the world. Part of it is also working with residents and fellows. I think that they add a lot to our ability to take care of children.
We get to train them, and then as they graduate, often go into do fellowships, go into private practice, stay on staff here with us, and so it's a joy.
Whether you want to be a clinician, you want to be a clinician educator, or you want to be a physician scientist, it's all here for you.
I wanted to be somewhere where I was going to not only utilize the skills that I made, but also continue to work and grow upon those skills. And when it comes to the newer interns or medical students, you realize how much you have really learned, because there's things that you do just automatically and they have never seen this before.
You should finish training here and be able to handle just about anything.
Oh, you've done research in this and this, and you have 2-3 papers. Wow. By the time you graduate, no one's going to question your skills.
We've taught them to start at the level where we are now and then go to the next level. And then all of a sudden you've got all these people that share a certain philosophy and mindset and ethos that then you can plug in the next generation. It's great.